Hello everyone, good evening. I welcome you all to Homeopathic Musing. So we have another session on ABCs of remedy, and in today's session, Dr. Preety Shah will be talking about the remedy Lac Felinum with some interesting case examples. Before we move on to today's session, I'll have a quick look at the ongoing module. So we have our ongoing course from classroom to clinic, which has been started on the 13th of March. It is a 6-month course specially designed for students and early practitioners, and it will help them strengthen their classroom basics and help them in their clinical practice. We have another course, the animal series, that is a 1-year course. It has been started. We are intending to take 8 groups of the animal kingdom, and the next group that would be taken would be sea creatures and crustaceans, and it will be starting in April. In case you haven't registered, you can register, and we can provide you the link, the recording for the previous groups in case you've missed any of them. We have another course, the cancer management, which will be starting in April. It will have total 8 sessions, and it will be taken by Dr. Ajit Kulkarni sir. It will be one of a kind course where sir will be talking in depth about cancer management through homeopathic perspective. We have another course, the understanding of autism through contemporary concepts of homeopathy, that will be taken by Dr. Aradhna Chitra, and it will be starting in May. We'll have total 4 sessions, and Dr. Aradhna will be talking in depth about the management of autism with homeopathy. We have another course, salts of row 1 to 4 from the mineral kingdom, which will be taken by Dr. Shekhar Algundi sir. It will be starting in June, and the timing for this course will be from 6 p.m. onwards. We'll have total 4 sessions. Before we move on to today's session, I'll have a quick look at the basic hygiene factors. So I'll request to mute your lines all the time. In case you have any questions, you can put it in the chat box or raise your hand and I'll unmute you and address the questions at the end. Please do not scribble on the screen as it is very distracting for the speaker. We'll suggest you to keep your videos on for an interactive session and enjoy today's session. In case you have any query, feel free to contact us on the below given numbers. I'll quickly hand over to Dr. Preety, ma'am.
Okay, so thank you so much, Taskin, for the wonderful introduction. And let's make a quick start. Let's dive straight in. So, ABC of Remedies basically is a series where we are going to kind of dissect each remedy and basically talk about the remedy in detail with some case example and like really study the A's, the B's, and the C's of these remedies. Okay, it's as simple as that. And we have done that, for quite a few remedies now. So if you haven't looked at, you can go to our YouTube channel or even see it on the Instagram channel. Today, what we are going to do is talk about Lac Felinum. So what I will do is maybe talk about the remedy a little bit, and then we will discuss a case. Okay. So I will share my screen, and you all can let me know once you're able to see. So Lac Felinum is basically our domestic cat. The cats that we see around us, they're domesticated. We have them as pets, and the cat family is called the Felidae family. It's one of the Lac group of remedies that we have. They are mammals, and it's a very, very common remedy, very, very easy remedy, and we are missing this remedy in our practice. Yeah, so we are only focused on the Lac can and Lac defloratum, but Lac Felinum is something which is so easy to catch. and so common. I mean, a source which is so easily accessible, available, has so much interaction with human beings. We shouldn't be missing this remedy. Okay. Now, I'm assuming all of you all can pick up animal themes in a remedy. I'm assuming all of you all know about the common themes of the LAC group of remedies, the mammal group of remedies. So I'm not going to kind of cover that in detail here, but to just give you a structure, that Lac Felinum belongs to the animal kingdom. So it will have all the animal themes of me versus you, hierarchy, one-upmanship, territorial, etc., etc. Within the animal kingdom, it belongs to the vertebrate group of animals. Mammals are vertebrates. They have vertebras basically, and it belongs to the mammals. So the group themes. So the mammals are the animals that live in groups. The herds, the group, the pride of the is very very important, and there are specific themes, homeopathic themes for this group of remedy. What is their role in the group, what is their stature in the group, how important they feel in the group, or how less important they feel in the group, how dependent they are on the group, and how conflicted they feel with that, because they want their independence, they want their freedom, some more and some less. uh, there are other themes with other characteristics of the LAC group of remedies or mammal group of remedies, and it depends on whether these animals are these animals are broadly classified as prey animals and predator animals. So all of them have unique themes, and very characteristic symptoms that we can easily pick up. Okay. Now, Lac Felinum belongs to the Felidae group, which is a predator group of animals. So you have the domestic cat and you have the big cats. You have the cheetahs, the tigers, the leopards, the lions, all of them belonging to the Felidae. Now, the domestic cat or Lac Felinum, the main idea is that they are always connected with the theme of dignity, royalty, grace, and power. You see this little woman here with so much grace, with so much dignity, with so much confidence. We say, like a cat walk. They are very precise, they are very royal, they are very dignified. As like all felines, cats too have a great leaping ability, acrobatic skills, and sudden short bursts of speed. So in homeopathic world, you can see a patients, who are fairly more acrobatic, fairly more sporty, and very very flexible. Their walk, like the source, the actual domestic cat, if you see, the walk is also very very precise. They will keep their hind foot and and put it in the front in a way that it's so precise. And cats have this unique ability to survive even if they fall from high places, and they can safely ground themselves. So this sometimes when you during the case taking, these themes can come up. Another idea of the Lac Felinum is the idea of strong sense of independence. The main conflict in the Lac Felinum is that how independent I am in the group. They feel conflicted that I need the group. I'm dependent in the group. My family is important, my work is important, but at the same time, I feel constricted by them. I feel restricted by them, and I want to be independent. So there is always this conflict that, how much of myself I should give, how much of myself I should sacrifice, how much of domination I can bear for my safety, for my security, for my money, for my position, for my power, whatever, and how much of my independence, my self sufficiency, my pride, my freedom will I get. So, this conflict is always there in Lac Feline. They have a vested interest in the group, they have a vested interest to be with the family. Yeah, but they would ideally want their space. They love to have their own space, their own independence, their own freedom. If you have seen, cats often dislike being stroked when they don't want to. For those who have pets, or who have had interaction with cats, you will see that how a dog would like to be petted versus how a cat would like to be petted. it's completely different. You can only pet the cat when she is ready to receive the petting. Also, if you see this image, it's quite funny, but it is so true. How a dog thinks that you love me, you pet me, you feed me, you must be my God. They're very needy, they're very dependent, despite all the abuse that they get, despite all all things in life, they will follow the master till the end. But cats are not like that. They feel their attitude is that you love me, you pet me, you feed me. That means I must be the God. Yeah, so they have this sense of this attitude, this haughtiness, this sense of that I am the queen, I am the princess, and the world revolves around. Oftentimes in patients who come to you needing lac felinum, and if they're child cases, you will see that parents of lac felinum children often say that these children would come to them on their own accord. They don't like to be caressed, they don't like relatives coming and invading their space. They're not the hugging and the kissing types, and they can play on themselves, they will pretend play, they will role play, they will read stories, they will do their own thing, and they don't like to be disturbed. Okay, so this is very, very important. Another aspect which also has come up very, very strongly in the proving is the voluntary dependence. So there's a lot of literature that kind of confirms the fact that cats, originally somewhere in Egypt or God knows where, they are the ones who decided to get themselves domesticated. They are the early cat, the early Felix. They came closer to human settlements for their survival. Because for cats, they're predators. So when I say predator, that means they need to hunt their prey. Okay, and prey is not easily available. They have to do a lot of hard work to find a prey, and they have to hunt the prey, they have to look for a prey, and then it's a lot of hard work, and there is a lot of difficulty in finding that. However, humans at that time had a lot of abundance of food. They had grains there, during agriculture revolution, there was a lot of storage of food. So in order to get easy access to this food, the cats slowly started coming near the human settlements. And they wanted to be accepted by the humans. So they started behaving in a certain way that humans could tame them. So unlike dogs or unlike horses or unlike sheep or unlike cows, they are not the ones who were domesticated by human beings. These are the beings that chose to get domesticated, which means that they are freely, out of their free will, they said, okay, I want to be domesticated. You are now master. I'm going to sacrifice my independence for the sake of my survival or for the sake of the comfort that I need from. Okay. But also it means that because I have chosen, this is my decision, I can always walk out. So cats will never get bullied. If you treat a cat badly, if you treat in homeopathy, if you treat somebody badly, if a patient needing lac felinum, if you treat them badly, they're going to walk out of that relationship. They're going to confront, they're going to fight, they're going to be very vocal. Unlike lac can patients would, maybe even shout and fight. They will say that, oh, I'm like being treated like that, I'm being treated like shit, but I'm going to stay in this relationship. I cannot walk out of this relationship. So it's very, very different. Okay. They will strongly voice out their displeasure. They will strongly, confront. They will get into a fight. Okay. I had a very, very interesting case of lac felinum. And, during the case taking, the patient said that, there was somebody who was bullying her sister. Okay, and the sister couldn't do much about it. So this patient, what she did it, she went and she was very, when this incident happened, she was quite young, she was a teenager. So she went to this boy's house, the boy who was bullying her sister. She went to his house, and she confronted her parents, and she said, look, please look after your son. He's bullying my sister, and next time if he does it, then there's going to be nobody as bad as me. Okay, look at his size and look at my size. I can go on him, I can pounce on him, I can make sure that he doesn't do this, not just to my sister, but any other woman ever. After going confronting to the, the parents, she also goes. In India, we have something like, they're like these big apartment complexes, and all of them form some sort of a governance body. It's called like a society. So then she goes to the secretary of this governance body and says that, look, there is a member in your apartment complex, and he's behaving like this. So you better look after it, or next time I'm going to bring the police and look after it. So they're not afraid. They're very upfront. They're very vocal, and they will not be as submissive as the candidate family. They need the family, and at the same time they want to be free. So that's their whole fight. One side, they can't refuse because they are a mammal, but at the same time they want to do it. So there is an inner haughtiness. You can imagine the puss in the boots. Fighting is a cat quality, but at the same time they are dependent. Imagine the life of a gold digger, a queen who has to work. I'm not a slave. I'm not to be domesticated, but I am domesticated because you know what? I need the comfort. I need the pleasure. I need to marry this old man because of whatever reasons I. So you can't put me in one corner like a furniture in the house. Yeah, they're not going to be tolerating that. So family versus myself, they also feel that I am not in control of my life, so they want to be over controlling. So control is a very important theme or a very important word. They will be stubborn, they'll be very controlling, they will be very fussy, they will know what they want, what they don't want. They will not tolerate anything like that. Control is also a very important word from a personal evolution method. Dr. Gandhi, very, I mean, this remedy, I owe it to him completely. I've learned it only through him in so much detail. So the main idea of lac felinum is the control, which also belongs to the inner age development of the anal stage. It's a very toddler thing. During the anal stage, during the toddler age, what does one child learn to do? He starts controlling his bowel movements, right? So if you have to control your bowel movement, you don't no longer have the liberty to kind of pee and poop anywhere. No, so now you have to be potty trained. You have to go on. You have to control your sphincters and then go release at a particular place at a particular time. So the main idea, the main learning at that age is about control. So this is also seen in individuals who are stuck at this level. So lac felinum belongs to the anal stage of development, and control you see as a big theme in this remedy. So I already spoke about it. So anal stage, along with the anal stage, there's a lot of haughtiness, there's a lot of adolescence theme, a lot of need for freedom, a lot of need to be a rebel, cannot tolerate dominance. So on one side, there's controlling, there's one side, things to be perfect, the way I want it. I will not take any, criticism. They will be very particular about their choices, about cleanliness. And on the other side, they, want to be free, self-willed. They feel like trapped in relationships. They feel trapped at work, and they don't want to take any obligations, and they want to be a rebel and do things out of their free will. So our own, my own experience along with Prajakta is that I can clinically tell you out of, we've seen at least more than 10 cases of, clinically cured lac felinum. Okay, and I can confirm that cats can be very particular about the place they do their business. That means they're very, when I say business, I mean, especially for example, if they have to kind of do, for example, they need to go and pass motions, pass stools, they will be very particular where they go and do it. They will be very shy and territorial about their behavior, about their hygiene. They are very shy toileters, let me put it that way. In the nature also, if you see, for those who have have had close association with cats, you can see that they, like dogs, you see, they are peeing and pooping anywhere, right? And you have to kind of carry the how to kind of pick up their poop. But you have to have litter boxes for cats, and they will do it in very privacy, and they're very hygiene conscious, and they will quickly cover up their things. So they're very hygiene conscious, they're very shy toileters. So you see that in also patients. Also, cats in in nature, you see they spend a lot of time in grooming. So if you see a stray cat versus a stray dog, you see the difference in hygiene, how they look, how they carry themselves. It's completely different. Yeah. So grooming and hygiene is also a very, very important aspect in the lac felinum patient. Okay. uh, there's a hidden haughtiness, they are very subtle. It will not be outright, it will not be like a lac leolinum, like a lion will come to you, you will feel extremely intimidated. A platina patient will come to you, you're going to be like, their haughtiness is coming out. It's outright on your face. But for lac felinum, it will be very subtle. They will be very sophisticated. It will come out. It will trigger in situations when they are triggered. It will not be like outright on your face. It will not be very gross. It will not be. They will not be very crass as individuals. Now, there are two very interesting provings of lac felinum. The one that I really understood the sense of lac felinum is from the proving that was done by Dr. Divya Chhabra. It's an excellent proving. If you can get your hands on it, you must read it. You will really understand the whole idea of lac felinum very, very nicely. One of the dreams that I remember very precisely in the proving was about this one prover who dreamt that, that she gets wet in the rain and her clothes are completely drenched. And a family friend invites her to her house to say, why don't you come and why don't you get changed, So this prover goes, and then she goes to change. She goes in the bathroom, and then she realizes that while she's changing, that there is a big crack in one of the walls of the bathroom, and that bathroom crack opens into the main living room of the house. And in that living room, the family friend's son is standing, and he's peeping and looking at this prover. And she's like, oh my God, somebody's looking at me when I'm, changing, and, I'm naked, etc. And she's wanting to shout, and she's telling, don't look, otherwise I will call your mother. And he's like saying, why don't you call my mother? He doesn't care. And she's feeling the whole essence, the feeling, the experience was that, should I call, should I shout, and should I scream? And that will mean that I'm ruining the relationship with this family. Or should I protect my dignity? Somebody is looking at me while I'm changing. What should I do? This conflict that, should I protect my dignity? Should I do what I want to do? Or should I, take care of the relationship that I have with this family? This same prover got another dream, which was about that, she's sleeping, and there are three men that come to her, three black men that come to her, and they say, come, you have to come with us. He is calling you. And what they mean by he's calling you is the same son of that family friend. So this feeling that, I have completely, like, I'm completely given myself, my self-worth. I have cheapened myself, a lot of themes of prostitution came out, that, how much of myself, like, how much I have to deteriorate to be able to kind of maintain, my comfort zone, to maintain my dignity or whatever, So how much sacrifice? So this conflict is very, very, like, the core of this remedy. Okay. Massimo says there's a lot of violence, there's a lot of sexuality, there's also a lot of fear of pointed objects and photophobia, etc. And there are, some other symptoms that you can see in the repertory about this remedy. Yeah. So dependent, as if I'm on the mercy of others. Abuse from sexual aggravates. Abuse, there's a big theme of abuse, if you see. And then they feel that they cannot escape. Only three remedies are there. Delusion that cannot escape. Only three remedies. Delusion that they are worthless, they are stupid, they are ugly, they are wretched. When they look at the mirror, they feel I'm not good enough. This is a very strong mammal theme. A lot of mammals, if you see delusion, dirty he is, you will see Lacan also. So this is a very characteristic mammal theme. However, that I'm not looking good enough, I'm stupid, I'm worthless, and I cannot escape this, a position in which I have put myself in is very, very strong in the lac feline. And then dreams of rape, snakes, prostitution, rats, etc. One last thing that I wanted to talk about before we go to a case is the main difference between the Canidae family and the Felidae family. So if you look at, there are within the predator group of mammals. So the two strong predators are the Canidae. So you have the lacan, then you have the lac lupinum, which is the wolf, then you have the fox, etc. So basically the dog family, and then you have the cat family. And there are some major differences between these two. So when you come to a lac group, you come to mammals within the animal kingdom, you have to differentiate whether it is a Canidae or a Felidae. So in the dog family, you will see there's a lot of competition, lot of hierarchy. There's a lot of, you've seen two dogs fighting, two dogs from one. So even if if you're driving your car through a lane, and on your tire, if another lane's dog has speed on your tire, how they're going to follow your car like crazy? They're very, very territorial, and they're very, very competitive. Who is the boss? And they're just all the time barking at each other, all the time trying to see what is my position. You see that in the wolves also. They have very, very strict, who's going to be the alpha male, who's going to be the beta male, who's going to be at the back of the pack. So that's a very important thing. However, the main theme in felids is not about, they already feel superior. They already feel that, they are special, they are stronger, they are good enough. So that's not a point. The main thing is that whether I'm independent or I'm dependent, whether I'm free or I'm oppressed. That's the main idea. Mostly the dog family they love group. They need they're very, very needy. They will stay in the group is very, very important. Felids also need the group, but within the group, they're very solitary. So if you see most of the cat family, all the cat family animals are solitary. They don't live in huge groups. One exception, of course, is the lion. So the lion has a big pride around him. But in general, as a rule, as a thumb rule, they are more solitary as compared to the canids. And in canids, that is the dog family, the idea is very needy. They want to please the group. They are people pleasers. Felids are not. They don't need to please anybody. Others will have to please them. They will be very hard to be convinced and be pleased. Okay. So here in the dogs, the idea is accepting the dominance of the superior and submitting themselves. They are not going to, the felids are not going to be submitting themselves. They will, if they submit, the whole life is about this conflict. I've submitted myself too much. And why am I doing it? And I want to break free. I want to escape from here. Okay. They are more dependent. They are more self-sufficient. So dogs are more dependent. They are more self-sufficient, the cats. It will be very easy for them to share things, like if you see in homeopathic standpoint, for example, if you see the wolves, they will be like, they are so responsible. They will take care of their wounded. They will take care of their, elders in the group, somebody who's kind of broken their leg or whatever. So they are very, very easy in sharing and doing things for each other. Felids are more, in a way, less sharing, in a way, more selfish, for a lack of better word. The words that are important in the dog family is endurance and strategy. How do I plan? What do I plan? How am I going to get ahead? The idea in felids is my power and my strength is enough. Okay. Another thing is, if you see also, is that dogs are more loyal. Yeah. So we know, no, most of the people who have pets, and you ask them why, what do you love about them? They are the most loyal friends. They are very loyal, very faithful. And felids are they're more independent in the relationships. They may be responsible, they may be providing, but they don't expect a lot of appreciation in return. They're not emotionally dependent or needy in their relationships. Okay, and they could have multiple partners. They will not be, loyalty is not a theme of the cats. Okay, generally, I mean, in Lac Felinum, you will not see it so much. So in big cats, you will see that there will be a strategy of how they are hunting, how they are killing. So if in a deep case taking, you can find the theme of, chasing and killing through suffocation and catching hold of the prey and suffocating it to death. So you will not see so much in domestic cat because everything is provided for, everything comes to them on a silver platter. But in big cats, you will see this active chasing and killing by suffocation, etc. Canids are more active, more playful as compared to felids who love their lazing and grazing and just kind of sitting and lounging. They prefer that more as compared to the canids. So again, in homeopathic or in the human language, big families and groups and joint families, and felids is more nuclear families, small families, more by themselves, etc. I spoke already about canids not so finicky about cleanliness. Felids very, very particular about grooming and finicky about cleanliness and perfection, etc. The main delusion of dog will be that I'm ugly, I'm disgusted, I'm disgusting, I'm not wanted, I'm not as beautiful. The main idea in felids is that I'm the queen, I'm majestic, I'm beautiful, I'm the top of the universe, etc. So they have high self-esteem as versus the dogs. So this is in short about the Lac Felinum and differentiating the two major predator groups. Now let's do a case of Lac Felinum. And what case I thought would be interesting today. See, a lot of this is easy in adults. But I thought it will be very interesting to demonstrate that how you can come to a lac remedy, how you can come to Lac Felinum in a child case. Yeah. So I picked up a child case and let's see, how we can identify Lac Felinum in the child case. So I will share my screen once again. And this patient had severe 3 years old and severe constipation, like very severe constipation. And she came to us in 2020. And basically both the mother and the child had come for the first consultation. So it's very difficult to, because the mother was giving the history and it was, her history as well as her child's history together. So both the cases are kind of intertwined. It's very difficult to separate one from the other. So we put everything together. The child had constipation and the mother's main complaint was otitis media. Both the cases needed animal remedies. The child's case, it's not a surprise. I'm giving you, explaining Lac Felinum. So it's a Lac Felinum. And the mother basically needed a reptile remedy and both did really, really well. So she said that this child would not pass stool for 15, 17 days at a stretch. And they had to do like severe things. They had to take her to the hospital. They had to do a lot of things for her constipation. And since her birth, this has been a problem. And because she was a premature baby, she was born at 24 weeks. She was like the youngest child at that time in India, 550 grams. That's all she weighed. So, everything for her was difficult, like you can imagine, right? 24 weeks, it's too early, too soon. And so, she was breastfed until 2 years, and she went through a lot of rigorous things. So the mother says that the pregnancy was overall okay, but during the labor there was a lot of constipation, lot of problems, complications. 2 weeks after she was diagnosed, so basically she went into labor 2 weeks after the mother was diagnosed with gestational diabetes. She went into labor. And it was like one kick in the tummy. And the next morning, she started experiencing pains and had to be immediately rushed to the hospital. So the doctor on duty said, she had just gone for checkup. The doctor on duty said that you need to immediately admit yourself. And of course, it was too soon. It was only 24 weeks. So, they were trying to say how much they can delay this labor. So day one, they were able to kind of stop it. But then the mother developed constipation and she had to go pass motions. And then when she went to pass motion, the doctor said, no, 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 absolutely, you cannot put any pressure. Otherwise, your baby will immediately come out. So the mother was asked to kind of control her stool. She was not allowed to pass motion. And she was given an enema at that point in time. And as soon as she was given enema, she went into labor. Like then there was no going back. So the baby was delivered by C-section and she was kept in the neonatal care for 80 days. When the baby was brought home, she weighed around 1.9 kg. So when she was born, she was only just 550 grams. Then, slowly she kind of gained some weight. And then when she was brought home, it was very, very difficult for her to gain further weight. So they advised her to go into kangaroo care. So kangaroo care is that the baby's all the time like kind of stuck to the mother. And that kind of, it's like a womb outside the womb. Yeah, so that's a technique and a therapy which is very, very effective, in premature babies. So after 6 months, when solids were introduced, everything went haywire. So while she was on kangaroo care, she was okay, but once solids was introduced, that's when she was like gone. Then constipation, kind of severe, it became more and more complicated. Then they tried some biodynamic craniosacrotherapy. She was given a lot of other therapies, speech, growth, development. And this constipation, they were not able to, nothing that the mother did for the child. And she did so much. She left her career. She was for 2 years only focused on her child. Imagine kangaroo care. The mother couldn't leave the child at all the time she was with the child. So, but nothing that she did to help her constipation. So this is just a prelude to the case. So then we ask her about her nature, the child's nature, the core nature, her behavior. So the mother says she's a very happy child. She's very mischievous. She has a good sense of humor. Um, she likes teasing, the mother says that I don't know why she can bully me. Like like she will purposely do something or pass up a remark in a way that I don't know why she would kind of target me and bully me. She would love that and she would get very amused by that. She would say, pass a remark or, say something, notice something of my behavior or the way I'm dressed. And she'll find it kind of very amusing and laugh about it. And she has a very good sense of humor. So I mean, it's easy for her to kind of grab attention, pass a remark, and immediately the room full of people will kind of break into a laughter. She doesn't have a lot of affinity with toys. She can get very bored soon. Instead, she likes reading books or listening stories. So the parents, what they had to do it, they had to hide the stack of books they had, because if the child came to know that this is all the books that are there, she would not sit. She would just grab all these books and want to kind of read them day and night, and wanting the parents to read those books to him. But one day they tried to hide a lot from the child, but then one day all books were out. She knew where the hidden treasure was. And from that day onwards, every morning, every afternoon, every evening, somebody had to sit and read those stories, or she would non-stop read. So she was not so much fascinated with toys as much she was with books. She's a very intelligent child. She's picked up languages at the age of 3. So the mother spoke, I think, Tamil, and the father was a Maharashtrian. So these are regional languages in India. They also, I mean, in India we speak Hindi. So Hindi she could speak English, and the parents would watch some French movies or whatever. So she started picking up French also. So it's very easy for her to kind of pick up languages, grasp things, and also kind of switch from one to another. So then the mother says that while she's only 3 years old, but if you look at her peers and if you look at the people, other children of her age with whom she plays, or in the school or nursery or whatever that is, playgroup, whatever wherever she was going, they at least can do certain tasks themselves. This child of mine, no matter what I tell her, it's like as if purposely she doesn't know. She's such an intelligent, bright child. She can do everything, but it's like, she would want me to do things for her, as if I'm my purpose of life is to do things for her. So she'll make me do things, and she'll behave as if so. It isn't like that I can't do it. It's also not something like, that I'm too lazy to do it. It's not that. It is more in like, it's more like I'm so smart enough that I can make my mother do things for me, and I will be like, okay, I don't want to do this. I would rather sit and read a book or enjoy myself, and I'll have people around me who will do things for me. Okay, so there is a difference. The essence was different. It was not a Calcutta Cup child who was like completely pampered and saying, "Okay, mother, get me water." Oh, you read the book for me. Not like that. She's not a lazy person. She's not. She's a very smart, intelligent person. Also very active, but she chooses to be completely dependent on them. She loves going for shopping. She likes to wear different shoes. She likes to be tickled, she's very physical that way, but only with her loved ones, only with the close family. She will not appreciate if others will do this. She's also very restless. She'll go from one place to another. She's per se a cautious child. She's not a big risk taker. So she'll run here and there, but and maybe hop and jump also. But she's not like a big risk taker. Like, she'll not like jump from somewhere and not worry that her, she's not going to get hurt. So she's not reckless that way. Another thing is that she loves music. She hums a lot of music, and she enjoys music. She also likes to do a lot of pretend play. So she'll become a dinosaur and play like a dinosaur, or she'll play like different animals, and she enjoys that, like and a lot of pretend, like how they would behave, how they would talk, how their families will be, like that. Very, very talkative. She can make conversation, and she'll go on and on and on about everything she has to tell. And so she's very talkative, has a very good memory. So she'll recognize people. She will know, oh, that day you had told me this. Then another incident was like a house help who was there when she was very, very young, and she'll see that house help somewhere, and she's like, oh, I know this person, why she's not coming to our house anymore, etc. So for a 3-year-old, she was very, very nice, very, very sharp. So then I asked, because she spoke about a lot about the birth process, and I know it was very difficult. So we asked, how was the birth process? We imagine like 24 weeks. So we thought something crucial can come out of there. So she says that I was supposed to go for a family ritual at a relative's place in a village, but there was something that stopped me from going. So in our in-laws' house, there was somewhere in the southern part of India, they had to go for some relative something. And she said that in the last moment, she said to her husband that, look, I don't want to come. I would rather, stay back at home. And her mother-in-law, so the child's mother, so child's grandparent, basically, so this mother-in-law of the mother, she was very upset with this mother. And so she rung, I think she went in Chennai or some place like that in the southern part of India, and she called from there, and she said that, look, it was my brother's something function and you're missing it. And they had a heated argument, and there was a lot of tension, and she felt that I am pregnant. I said I don't want to travel, and nobody's understanding me, and nobody's thinking about me. And then what happened is, on the day of the ritual, when the ritual was there, this patient went into labor. So there was a lot of tension, lot of argument, lot of despair, and then immediately she went into the hospital. So you know we asked her, a little bit, because there was a lot of tension here. So we asked to talk about this a little bit more. So she says that, ours is we come from different cultures. I'm a Maharashtrian and my husband is a South Indian. And though everyone in my extended family had accepted me, my mother-in-law did not accept me completely. I come from a very traditional Maharashtrian background, and I was born and brought up in such an atmosphere where my parents gave me all the rights to do whatever I felt was right. And here, when people didn't agree with me at my in-laws' place, it was very, very difficult for me. So my relationship with my mother-in-law from the beginning has been very, very, I was tried and tested. And no matter what did, I couldn't mend ways. I couldn't change our relationship. But after my child came home, she actually became the strength, and then, my child kind of helped to my, child brought kind of peace in the house. And because my mother-in-law saw that how much I did for my child, and how I, she also mellowed down, my mother-in-law started supporting me. So I asked her what happened when somebody doesn't listen to you. She said that in my parents' house everybody listened and there was a lot of freedom, and here I would get worked up. So she said, "Did you?" So it was very interesting. So when I asked her that if somebody doesn't listen to you, how does that make you feel? So immediately what happened was like, I can't even do this. So one of her eyebrows like went up, like this. And she's like, did you just see my eyebrows going up? It's an automatic. Like, and it's not just me. Even my daughter does that, Her eyebrow will just simply go up like that. Like, oh, really? You're not going to listen to me? Is that what? It's like we are a little more dominating people. We are the ones where we are the bossy kind. We want people to listen to us. And if they don't listen to us, it's just our bossy nature. I'm being very, very honest. That's how I am. If there are people who are inefficient or people who back answer us or they don't do as per our wish, you know, we are not going to be, easily tolerating that. I did not like people telling me that no, you are wrong or your decisions are not right. I will not appreciate that. I know I take the right decisions. I'm intelligent enough. I'm independent enough. I used to be very, very angry and very, very short tempered. And I used to be like that. I don't remember feeling those things when I was pregnant as a person, maybe. But I had these incidences in my life which would always trigger that. So I say, let's stay on this point that you're not being heard. Nobody is listening to you. In that moment, how does it feel? Somebody's not listening to you. You can't tolerate it. And how does that make you feel? So she says, I get this knot in my chest. I like a very angry knot, and I feel like saying something. I feel like saying something really nasty to that person. And I try to remember the nastiest thing that I can say to that person, downright, to be very, very personal. And she can use, like any language to kind of get back to that person. So I would say that English stops from being, English is a little sophisticated language and it helps me kind of keep my composure. But otherwise, I can get like really below the belt. So she says that when something like that happens, I become very shaky. I become very angry. Something inside me is, I'm losing something. Something is resonating and everything. Then out of, it goes out of the window. It goes out of control. So what do you mean shaky? I can like, what should I do, man? How do I explain to this person? Like I want to physically shake this opposite person and say, what? You don't want to listen to me? You don't even have the brains, you can't understand what I'm trying to say you. So that's what happens. My hands become sweaty, my legs become cold, my heart becomes like, literally balmy and sweaty, and it's a terrible, terrible feeling. So that is one aspect of the case. Another aspect of the case is, then I kind of asked that when you went into labor, what was your state of mind at that time? So she said, like, it was utter panic because I was alone. My husband was in a meeting, and that day a new had joined. So I mean, I had to pick up myself and go to the hospital by myself. And over there, the doctor is telling me, get yourself admitted, and then telling me that you can't pass motion. You're going to have child anytime, and the child is too young, and you can lose your child. So you have to be mentally prepared. So I told my husband when he came that let anything happen, I am going to have this baby. This is the only baby that we are having ever. Otherwise, we are not having any baby. So we went ahead of it despite the risk. The doctor said that, it's maybe best, it's in the best interest for you that, maybe we don't, I mean, taking care of you as a mother is more important rather than the baby. But despite all the risks, despite all the options that the doctor gave, we went ahead and we said that we have to save the child, come what may. So, her whole state of mind was very, very panicky and very, very fierce and very, very protective of the child that I have. So this, you see, this is giving us a theme of how the, so this state of, so much passion and love and want for the baby, this is also kind of giving us an indication of the lack remedy here. So it's kind of transferred from the mother to the child. Basically, I felt angry on myself that, I did prenatal yoga, I went to the best doctor possible, I went to the best hospital possible. And then finally, what I had to do, I didn't have to do all that. I had to just keep this baby inside me, and I'm not able to do that. How stupid am I? How worthless am I? I was so angry, so self-critical that how could I not take care of my baby? And now, no matter what, I had to just kind of uh, it was like, I don't know, there is no feeling like this. How can you even think of, not going to be able to have the baby, that my baby is not going to survive? It was an impossible. So I said, I don't want I don't want anybody to tell that it's okay, be mentally prepared, there will be a next time. No, this is the baby I want to have. Come what may, this baby will survive, and whatever is possible in my capacity, I'm going to do. So normally in pregnancies, like when you're in a labor, doctors would say push, push, push. And for me, people were telling, don't push, don't push, don't push. You're not supposed to push. And I'm like, oh God, I'm telling, I'm putting all my might. And I'm saying that control, you're not supposed to let go of your sphincters. You see this anal stage, this controlling theme, how beautifully it has transformed from the. So you have the lack theme in the mother's history, it's so prominent. You cannot ignore this history. And this idea of don't push, you have to hold back. You're not supposed to go into labor. You're not supposed to pass stool. You're not supposed to open up. You have to keep your vaginal muscles. You have to keep your anal muscles tight. That is the anal stage of development, or how that state got transferred even to the child. So it's like almost controlling. So when initially they didn't let me touch the baby because I had chest infection, they didn't want an NICU baby to be touched by the mother. But after 10 days, I could touch her, and they opened a little window. And I could go and touch my baby, and I could touch her with my pinky finger. She was so small, and I was so scared to touch her. But slowly, very, very slowly, it didn't register at first that she was my child, but slowly that feeling started coming. And then, I had to pump milk. She was not able to take milk, and we had to store milk. So then the whole grueling process of taking care of the child, the extended womb outside of my body. So I had to keep her close with me all the time, and another thing that she said, that the first time she was hardly a month old, and the mother said that even the doctors and the therapists recognized that, they noticed that the child smiled, and for her it was like such a small baby, such a premature baby smiling. It was very, very good, very, very big deal. So then she talks a lot about how that whole initial 1.5, 2 years were, and day and night the whole job of the mother was only to look after the child. So by now for us, we were clear that this is a lack remedy for sure. A lack remedy which is very independent, talkative, intelligent, she can bully, and there's a lot of anal stage of development. So in my mind, I'm kind of, okay, I know this is Lac Felinum. So I asked some direct questions. So I asked her about, is she very cautious or is she very reckless? So she said that she is cautious. And then she also talks about this, very interesting, and I don't know if it is kind of there in the slides ahead. But another thing that the mother said that she's also very picky about the kind of music she listens to. So, you know, uh, so if you see, there is one music which is mass music that is appreciated by the masses. Yeah, so there's a lot of Bollywood music, for example, in India we hear, and a lot of dance numbers. And this patient, this child, she doesn't enjoy that. If there is a loud dance number or a like a typical Bollywood music, she'll not enjoy much. But if there is some classical music, there's some nice flute or some nice drums by Zakir Hussain, for example, tabla, she will enjoy that. So she is also very, very sophisticated and very, very picky and choosy in the kind of music she enjoys and loves. So this is also so peculiar about the child, and such a young child. It's out of the ordinary. Another thing the mother says is, and this I told you during the Lac Felinum discussion, is that one thing about her passing motions I need to mention, that she will go in the balcony. She will go in the balcony. She will play there, and when nobody is looking around, then that time. So when she's at home and you not put her the nappy. So in India, it's quite common that at home one would not put the nappy onto the child, and it would be a cotton nappy or whatever. So that time, what she would do is she go in the balcony, and when nobody is looking around, she'll pass her motions there, and she will not even tell everybody. So she'll be very, very private and very, very self-conscious. She will not do it. So this is again kind of confirmation. And I have seen this in such young children, in toddlers, and this is not. I have seen this in another child of same age. The same thing was that child would go and do it very shy when nobody's seeing, and they had that potty seat which they use for potty training, and she would go there in the corner, and the parents knew that okay, now she's going to try and do a business, so they will purposely not look at her, and they'll go away, and then they'll know that okay, after some times she will be able to pass her motion. So when this self-consciousness came about the stools, in general, she's not self-conscious. She's very extroverted. She likes attention, and she will go and speak to people, and she'll have fun. She's not self-conscious. She's not shy that way. She's shy in kind of passing her private business. Yeah. So in general, she's not shy. Then I asked about cleanliness, mother and the child. Very, very particular. She says, yeah, she doesn't like her hands dirty. She keeps a napkin with her all the time. And she doesn't like, if her clothes get stained or dirty, she would want to change immediately. If she's painting, she will not make it dirty. She knows how to do it. The lines don't have to go outside. The color doesn't have to kind of spill over. So she doesn't like messy. She's a very, very, particular cleanliness wise, and also perfection, in a way, there's a lot of perfection in her. She's also very particular. She's very selective about what color she wants to wear, what dresses she wants to have. She's very picky about what vegetables she will eat. She will only watch these two favorite cartoons that she has. She will not watch everything. About the music, I told you about the music. No, it's very, very peculiar. So she likes soft music. She likes very refined music. She will like folk songs. She likes classical music. So she will not like all these cheap songs or Bollywood songs, or what masses. So this gives you the air element, this refinement, the sophistication that I was referring to you earlier. And then this, I think we already covered that, that Percy, she is a smart, intelligent kid, but she will make me do things. She doesn't want, she kind of, can you remove my pajamas for me? Can you put this in the basket for me? Can you remove my book for me? Can you read me a story? She'll make me do things. Then I ask about, is she a very physical affection? She's like, she is a physical person. She likes cuddling, etc. But she likes to, she'll push herself between, like when the parents are sleeping, she'll want to come in between us. And she like to be kissed on the lips, etc. But only with just the parents, not, she will not appreciate if, if neighbors or extended family, etc., would do that. She will absolutely not like it. She loves sweets a lot, and she also likes chocolates. Milk, she doesn't ask that much. Very rarely she will like milk or appreciate milk. She doesn't like spicy food or even sour food. She prefers bland food. So she eats simple homemade food. Okay. So, in summary, you see the themes of the animal kingdom in the mother. So, pronouns, issue of survival, victim aggressor, feels victimized by people, by illness. People are doing this to me. Hierarchy, superior, inferior. Mother-in-law is dominating me. I will do what I want to be. I cannot be bossed around. We are bossy. If people don't listen to me, I'm not whatever. So, in mother, you see that. Then in the child also you see, no, that she's very territorial. She will tease the mothers. The mother says, no, that my child is also very fussy. You have to listen. And she has strict boundaries. So you see her subtle hints of the animal kingdom also in the child, not just the mother. So then once you have come to the animal kingdom, you whether is this a vertebrate or an invertebrate. So you see that this is quite developed, no? She's very developed, she's defined, she knows what she wants, she's very particular. So you know that this is a vertebrate animal. And once you know there's a vertebrate animal, you also know that the issue is of nutrition. She's fussy in food. The issue is constipation. So there's all nutrition line issue. Then relationship with the mother and the kangaroo care and the premature child and how the mother dealt with the pregnancy and when the child was so young. So you see all these nutrition themes. It was all about food and nutrition and love. And then you also see this issue of the theme of toddler age, the anal stage of development. You see that in the mother, you see that in the child. And then you see, some preschool and school age themes. There's a lot of initiative, industry, etc., etc. So we also come to the mammal group of remedies. We come to Lac Felinum, and rest of the things I think we already spoke about Lac Felinum in a lot of detail. Yeah, so the main theme is needing the family and wanting to be free. Yeah, only animal who decided to be domestic. So that is that. She received Lac Felinum 1M. The first prescription was in June 2020. She received that in once in a week for the initial month, and then gradually the repetition kind of diminished. Her appetite, she's also a very fussy eater, right? So her appetite improved, energy levels were good, her motions slowly started getting better. She was starting to pass motions every passing stools every alternate days, and this gradually kind of kept getting better. She became confident enough to pass stools, and she was not very scared of doing that. She started to use the pot now and doesn't do it in her pants. She informs her parents that she wants to go to the washroom now. She was slowly, her developmentally, she was growing well. So, overall, the mother felt that she was 60% better in 2 months' time. By 4 months, she said there's a considerable improvement. In between, there was some episode where, she would, she passed motion in her pants, but otherwise, that time SOS was given, she was okay. But otherwise, overall, she has done better. By 6 months, there's no constipation at all. She passes motions daily. She informs us. The streaking episode didn't come. So if there's too much constipation and too much hard stools, some blood would come out. So that has not happened. And physically, appetite also, her milestones are doing well. So she continued to do better. She continued to do better. The last follow-up was in 2021 in June. And overall, she was very comfortable and there was no pain and she was doing very, very fine. Yeah, so she did really well on Lac Felinum. Taskin already mentioned this, but I really invite you all to come and study the animal group in detail. Okay, so Lac Felinum is in mammals. If you see here in this course that is ongoing, we have 13 sessions. 13 sessions. Each session is of 2 hours, 3 hours duration. So you just see how much detail in which so many different lag groups, mammal group of remedies we've done, known, unknown, provings, lots and lots of cases. I can tell you in this mammal group, we are showing Lac Felinum, you will see 3 to 4 cases. So like that, so many in detail. So we have 13 sessions on mammals and one live sessions with a lot of new cases. So a lot of in-depth study is possible, a lot of remedies yet to learn and get confident in prescribing. So if you're not registered yet, I would invite you to do this. If animal group is something that you would like to master, then this is the course for you. So you have the link also here. Maybe somebody can put it on the chat for your convenience if you want to learn more on, what to expect from this course. So with that, I'm going to stop here and see if there are any questions before we sign off for the day. You're not bad on time, Taskin. For a change, I have stuck to my time limits.
Yes, ma'am.
Okay.
Anyone has any questions can put them in the chat box or they can unmute themselves.
All right, looks like no. So thank you so much. Please let us know in the comments if this session was helpful, if there's any feedback, if there's anything that we could do better to, or any remedy that you want to hear in the next ABC of remedies. Your feedback will be much appreciated.
Ma'am, someone is asking what was the remedy of the mother?
Should we keep it as a surprise for some other day? I'm already telling you she was a reptile. So you have to think of a reptile who is so possessive, or who can do so much for the child. So think like that. So which is the reptile? And you had so many hints of the mother in this case. Yeah. So think and let us know what you think about the mother's remedy. Anything else, Taski?
I think we are good to close today's session. I
All
don't see
right
any
then.
more questions. Thank you so much, ma'am, for sharing such
Thank
an
you.
interesting case.
Thank you, everybody.
Thank
Bye.
you, everybody. Bye.
Bye. Bye.